in my work with Picori, I advocate for community research partnerships, and I'm interested in slightly balancing the power dynamics between communities and academic medical centers. And what I find is that the issues and the nuances are hyper local, but the big things are universal. And so, like when I think about what you're saying about being sensitive to people's preferences, it seems, oh my God, that's a lot of hand holding. And so, do you think about 80% of it is people have common issues, and I can work on designing things that get to solving relatively easily that 80%, but that 20% is a bitch because there's so many factors, language, I'll just on and on. Um, so how do you, in your informatics leadership role, how do you balance your resources? Am I making sense?
Absolutely. And I think that's mostly what we're doing now because we don't have the functionality to manage those 20%, to really manage the just that nitty-gritty that is required in that 20%. So what we do is we have certain default settings
Mhm.
that we have created, and then we allow some technical capabilities on an individual basis. So we allow the clinician and the patient to decide whether a note becomes confidential or not, whether or not it is shared, if it's shared across the health information exchanges, if it's shared in the portal. So there's some granularity that we can create. We default some information to just not sharing for out of safety reasons. So a lot of sexually transmitted illnesses, we just don't share unless someone changes that. The
Mhm.
default is just not sharing. The challenge with that is there are risks and benefits to sharing and not sharing. And we
Mhm.
are very aware of also the risks that we run into with not sharing certain information and the importance of that. And so we try to discuss that with patients as much as possible.
Mhm.
But you mentioned that earlier too. How do you educate everyone and how do you inform everyone of where their information goes, where it becomes available, and what rights they have in terms of trying to control where that information goes and trying to filter that information across portals, health information exchanges, et cetera.
Mhm.
And it's a very difficult challenge. We try as much as possible, but I think often we end up making some decisions on behalf of patients and families because that's the only thing we can do. And we would prefer to have it completely in the patient's hands, but that's not always feasible.